I'm going to go over the basic armamentarium for local anesthesia. First, we're going to need our PPE, which includes this yellow gown, disposable yellow gown. We're going to also need our goggles for me and the patient. We're going to need our hand gloves and our face mask. Including that, we also need our sphygmometer and our stethoscope for taking vital signs. We're going to need our lolly canes, which are 20% benzocaines, and then we're going to need our actual syringe, which includes the syringe, carpules or cartridge. Today we're going to use the 1.7 cartridge, and then we're going to need our needles, long and short, and then we also have our hand mirror, our cheek retractor, which is the Minnesota, and our tongue depressor. And today we have May, who has come in today for a right maxillary first molar and lower left mandibular premolar extraction. Hi May, what brings you in today?
I've been having some pain up here and down here too.
Oh, okay. Well, before we do anything, I will need to go over your medical and dental history.
Okay.
Nate, is there any sort of systemic problems that you have that I should be aware of?
I don't have any.
Okay. Are you allergic to anything?
No.
Have you ever taken any blood thinners?
No.
Have you ever had any issues with local anesthesia?
Nope.
Great. Now, next, I will take a look at May's radiograph. After I examine May's radiograph, I've determined number 3 and number 20 cannot be saved, and therefore you will require extractions of those two.
Okay.
Before I do anything, I will also need May's consent. May, do you consent to the extractions of these two teeth?
Yes.
Great. Please sign this consent form. Thank you. Now I will need to check May's vital signs with the thermometer and stethoscope to make sure her blood pressure and her heart rate are within normal limits. Assembly of a syringe for a nerve block. We're going to need our syringe, our needles, and our carpules. First, I'm going to pull back on the thumb ring so I can place the carpule into the syringe. Afterwards, I'm going to take our needle, our long needle, and we're going to unscrew the syringe on the needle and then screw in the needle into the threaded tip of the syringe. Next, I'm going to use the palm of my hand to tap the back of the thumb ring so I may engage the harpoon of the syringe into the carpule. And then we have assembled our syringe. Demonstrate how to give an inferior alveolar nerve block. First, I'm going to uncap the syringe at the needle, and then I'm going to check for flow. Next, I'm going to position the patient into a long chair position where her head and heart are parallel to the floor. Now I have my lolly cane, which I will administer to May's cheek for topical anesthesia. Next, I'm going to go over May's shoulder and retract her cheeks, and then look for anatomical landmarks. The first anatomical landmark I'm going to feel for is the coronal notch, which is on the mandible. Once I retract the cheeks, I'm going to look for the pterygomandibular raphe. Next, I have my syringe. I'm going to place it to the contralateral premolars and parallel to the occlusal plane. I'm going to establish a hand rest or finger rest so the needle is stabilized. Afterwards, I'm going to insert the needle so the bevel is pointed towards the bone. As I insert the needle, I'm going to hit bone, and then I'm going to pull back a little. I'm going to aspirate to make sure I did not see any blood, otherwise that means I hit a blood vessel. If I do see blood, I will disassemble the syringe and assemble a new syringe. I did not see any blood, so I'm going to slowly administer anesthesia for 1 to 2 minutes. Afterwards, I'm going to remove the needle and let the anesthesia set in. I'm going to perform the scoop techniques to cap the needle. Like that. And now I'm going to assemble a new syringe for the long buccal nerve block. I'm going to assemble a new syringe. I have a new syringe. I'm going to come to the patient again. I will retract the cheek. Again, the target site is the mandibular second premolar. I'm going to aim at the ramus opposite to the mandibular second molar. I'm going to establish a finger rest and insert the needle until I hit bone. Once I hit bone, I pull back a little, aspirate to check if I hit any blood vessels. I did not. I'm going to administer anesthesia for 1 to 2 minutes. Afterwards, I'm going to pull out the needle, let the anesthesia set in, and again perform the scoop technique. To demonstrate the maxillary infiltration nerve block, I've assembled my syringe, but this time with a short syringe. I'm going to uncap the top and then check for flow. I'm going to come to my patient. The target tooth is number 3. I'm going to retract May's cheek. I'm going to establish a finger rest and aim towards the long axis of the tooth and towards the mucobuccal fold. I'm going to insert the needle until I hit bone, and then pull back a little and aspirate to check if I hit any blood vessels. I did not hit any blood vessels, and then I'm going to administer anesthesia slowly for 1 to 2 minutes. Afterwards, I'm going to retract the needle and let this anesthesia set in. I'm going to perform the scoop technique once again to cap the needle, close the needle. Now I'm going to demonstrate how to disassemble a needle. To disassemble a needle, I'm going to first unscrew the needle off the syringe over here, and then screw the syringe end of the needle back. I'm going to pull back on the thumb ring and remove the carpule out of the syringe. The cartridge will be thrown at the disposal of regular trash, and then the needle will be disposed inside if you feel like it's numb around the area.
Yep.
Now I'm going to go over the armamentarium for the extractions. Here are the armamentarium for the extractions. We have a series of forceps, which include the extraction forceps. We also have a series of bone contouring instruments, which include the rongeur, the bone file, the cowl horn, and chisels and mallets. We also have a patient's mirror, including that. We also have a syringe full of saline, which has helped to irrigate the area within the bone socket. We also have the cheek extractor, which is a Minnesota bite block, some suctions to remove some blood or some mucus and saliva, and lastly we have our sutures material to help suture the extractor. To begin the extractions, I have the elevator here for use for both the mandibular and the maxillary. There are 3 ways to use the elevator to extract the tooth. The first way is the lever part, which we're going to insert the elevator and then only turn the instrument in the direction so it catches the tooth and sort of as a fulcrum sort of elevate the tooth out of the socket. The next method is the wedge method, which is we also insert the elevator inside the tooth so it displaces the tooth out of the bone. And lastly, the last method is the wheel axle, where the elevator is used as a spear and towards the root, and then we sort of rotate the elevator so it starts rotating the tooth out of the socket. After we've elevated the tooth, we have our extractor forceps, where there are, to finally remove the tooth, there are 5 ways to use the forceps. The first way is apically, where we use the forceps apically as possible to expand the socket and then displace the tooth center. Next is the buccal force, which we will use to expand the buccal plate, the crest. Third way is the lingual pressure, which is expand the lingual crest of bone. The next way is the rotational pressure, which we rotate the tooth so it expands the bone socket. And lastly is the tractional force, which is used towards the end to finally remove the tooth out of the bone socket. After we've done and removed the tooth, we need to recontour the bone in case there are sharp edges or anything. That's why we're going to use the rongeur and the bone file. We'll go to the socket where the tooth was removed, and then we use the rongeur to remove any sharp areas that was left by the tooth. After we've done filing that down, we'll take the bone file, and then only in a pull motion and establishing a finger rest, we'll start contouring any sharp edges that there were bone left. After that, we've recontoured the bone, removed the tooth. We're going to need to use some saline solution to irrigate the area to make sure any tiny bone fragments or any blood is out of the area, and then to help clean it up. After that's clean, we're going to use the suction for any saliva that's also going to clean up the area. And lastly, we're going to need our suture materials to suture up the empty socket, the open socket that was left by the tooth, and close it up. Now I'm going to give post-operative instructions to May here. May, how was the instructions? Was everything okay? Do you feel all right?
Everything feels numb.
Everything's numb? That's quite normal. For post-ops, for if you feel any pain or continuous pain, you can take any over-the-counter medication, including NSAIDs or aspirin. The wound should heal about 7 to 14 days, but we're going to have a recall in 5 to 7 days to check how you are doing. If there's any emergencies like immediate pain or like anything like constant bleeding, you can call the office. If the office is not open, you may call 911 for any emergencies. I printed out all that information into this post-operative form for you to have.
Thank you.
Do you have any questions for me?
No.
All right, thank you for coming in today.
Bye.